Ghana is the first country to attempt to implement a continental agreed roadmap on shared responsibility and global solidarity on HIV and AIDS. And for this reason, the United Nations has assured Ghana that it would support her to ensure that the drugs to be produced would meet internationally agreed quality standards. The West and Central African Regional Director of UNAIDS, Dr. Mamadou Diallo, who is on a visit to the country, made these comments when he interacted with the Ghanaian media.
In 2011, UNAIDS, in collaboration with world leaders, re-emphasized the need to achieve universal access to HIV prevention, treatment, care and support by 2015. Ghana is, however, one of the few African countries which seems to be making strides towards achieving this goal. By December 2012, 62% of persons living with HIV and AIDS were said to have access to antiretroviral treatment ART, with 95% reduction of prevention of mother-to-child transmission. But the regional director of UNAIDS, Dr. Mamadou Diallo, said more needs to be done and the country should focus on eliminating discrimination and stigmatization associated with the disease, alternative funding for HIV/AIDS programs, and putting ART drugs on the National Health Insurance Scheme in order to support persons living with the disease.
Stigma and discrimination only achieve one simple thing: it drives people underground. So people get scared from coming forth and checking their HIV status. And by failing to do so, they deprive themselves of the possibility for accessing information on treatment if they need to.
He commended the country for putting in place a national plan to encourage the local production of ART drugs and gave the assurance that the United Nations will support the country with technical and human expertise to ensure that the drugs which would be produced meets international standards. If Ghana succeeds in making local production of ART drugs a reality, it will be able to provide better affordable drugs to persons living with HIV and AIDS around the world.